This patient with dental phobia was referred to us for endodontic treatment of tooth number 31. So you can see there is a large mesial occlusal decay into the pulp. You can see periproctal lucency here and forcation involvement. You can see an old amalgam restoration here as well. Because of the fact that this patient had dental phobia, unfortunately, the examination was very limited. So I couldn't probe, I couldn't percuss, I couldn't palpate. It was only visual examination. This patient has severe dental phobia, dental anxiety. So looking at the tooth itself, I could see a crack line here and a crack line there. Also, take a look here. There was also a small buccal parielis and sinus tract associated with the tooth, and that's the tooth right there. Okay. So I discussed my findings and options with the patient and her husband, and they wanted to try to see if tooth could be saved. They didn't want to extract the tooth. So this tooth, they knew the tooth had a very guarded prognosis based on my limited evaluation. As I said, patient has severe dental anxiety, dental phobia. So today went ahead and IV sedated this patient. And take a look. And here's the post-op. So tooth was definitely cracked. As I said, I cleaned out the decay and rebuilt that wall there. Tooth was definitely cracked. There was a crack on in the mesial wall, or whatever was remaining of the mesial wall, that stopped short of the pulpal floor. On the distal, same, a crack in the mid-mesial wall that stopped short of the pulpal floor. This tooth had two mesial canals, but it was one of those teeth that the two mesial canals were so close to each other, but definitely had two mesial canals and one distal. I want to see if I have a... So anyways, as you can see, everything went great. I got a nice lateral right into that furcation lesion. So that tells me that the tooth had endoperio. Again, you can see it right here. Again, I could not do examination on that. I would have loved to probe this tooth, but I just couldn't. But the probing would have probably likely been, I would say, maybe 3 to 4 millimeters all around. So anyways, you can see the lateral right into the lesion there in the furcation area. So went ahead and obturated with gutta percha and sealer, and then I used gray MTA or GMTA, and I layered the gray MTA over the fracture line, over the fracture lines, try to kind of patch them up, and then I used composite build up to build the tooth back up. So my gray MTA, you can see it. It doesn't have the radial opacity that my white MTA does. So like here, you may think that it's not there, but it's definitely there. But it just doesn't have the radial opacity that my other, the white MTA does for whatever reason. Again, you can see it here. It's there, but it's not as radio opaque as I would like it. And again, you can see the lateral right into this lateral lesion there, and this is just composite buildup. So we did all of this in one appointment, and again sedated this patient because of her severe dental phobia, dental anxiety. All right, so patient's going back to her dentist. Hopefully the dentist can crown this tooth. If not, then the patient will just have the tooth the way it is and see how many more years she can get out of it. This patient, by the way, has extensive medical history as well. She just recently had renal failure. So anyways, dialysis and all of that stuff and blood thinners. And so extraction is the really it's not an option at this time for this patient. So we really needed to try to save this tooth for her. All right. Anyways, so here it is.